Your ears still clogged? Well, you are my people. Last time we did some pressure point work, but with this video we're going to work the fascia and we're going to vibrate some of the mucus out. So let's start with some of the fascia. We're going to use our hands, we're going to use the tips of our fingers, and we're going to do some skin rolling on the masseteric fascia, right over your masseter muscle. So start right over your zygomatic arch. We're going to do both sides, so just start going. Pull, it's like you're lifting carpet. I want you to pinch and lift. You can even do a little rolling also like this. Get that fascia lifted up. When the fascia it has adhesions, oh, it can alter fluid flow dynamics in your sinuses, your ears. So now we're going to go down. We're going to do a little bit of work down, a little bit lower towards the angle of your jaw, and lift. Good. Let's go right by the tragus right here and work that. Tragus right by the ear, just pull it, feel that inner ear while you're doing it, tap in. You are the influencer, influence that body. Okay, let's go down towards the parotid gland. The parotid gland helps make some of your salivary amylase. So saliva is really important, and so is salivary amylase, which digests carbohydrates. So let's free that up a bit here, and we're gonna go over to the other side. Oh, that just feels so good. Okay, let's go to the other side. There we go. And just pinching and rolling. Pinching. If you can pinch and roll, do the pinch and roll. You're right here, that bone, and you're coming down like that. You're coming down right by the tragus. Let's hit the tragus area. That's it. Beautiful. Let's do this thing. This is something I work with every day. Eustachian tube dysfunction, otitis media, surfer's ear. We're here in California. Okay, there it goes. Now we're gonna pinch. Let's go to the tragus first. We're gonna pinch that tragus and just pull. Oh, love that. And then just gonna roll it around a little bit. Get right on that tragus and pinch and pull away from your body. That's it. Good. Let's go even right on the skin, right over the zygomatic arch, right there. We love it. Pulling, pulling, pulling. That fascia, it's a nice covering around your tissues, but it's supposed to glide. If it doesn't glide, there will be some issues. So go ahead and pinch and roll like this. Pinch and roll. You might have a little pain in there. That's not necessarily a bad thing. There might be some fascial adhesions. Anytime there's inflammation in your body, it does wall things off and you can get adhesions, even if it's not like some blunt force trauma or something like that. Just a little bit of repetitive inflammation can cause adhesions. Beautiful. So now we're going to go to the temporal fascia. We're going to go right here above the ear, and we're going to pinch the skin together. Take some strong finger strength here. I've got some rock climber strength fingers because it's what I do every day. But let's just go ahead and just pinch and see if you can get that skin to just roll. You feel like, again, like you're lifting up carpet. And go all the way back, all the way behind your ear. We're going following the joint of your temporal bone. You have about 22 bones that fit together like pieces in a jigsaw puzzle in your skull. And the fascia and even the joints can get fixated. And so we are trying to move it. We're trying to move that fascia, move those joints. This is healthcare. Welcome to healthcare. Okay, let's go to the other side. Beautiful. Pinching and moving. Pinching, moving. Good. You're along the joint, freeing up the joint. People say, oh, you're an influencer. I'm like, no, I'm not an influencer. You are the influencer. Keep influencing, please. I want to make you the influencer. Beautiful. Feel that little painful area in there. This also helps with hair growth, believe it or not. Okay, so we're going to pull your ears nicely and just wiggle your jaw. You'll feel that right in your ears. Pull the tops of your ears. Now I'm going to pull them back a little bit. Waggle away. And go to the lower part of the ears. Beautiful. Oh, that's good. Getting that fascia taken care of. Now we're going to vibrate a bit. So go ahead and grab some vibration device. If it's one of those big guns, make sure you put your hand and don't make it too intense. This one only goes about 1/16 of an inch, so it's wonderful. So we're going to go the heel of your hand right here on your face, and then your finger all the way up, and you're going to go to a point there. Right, that point's called the bregma. We're going to go right on the bregma. And I want you to just put that vibration and just close your eyes and just feel that vibration. Let it just rain down on you like a shower, like you're in a warm shower of vibration, right? And make sure it gets all the way to your ears. Feel that vibration, right? Movement is the medication, right? We need movement. No more stagnation. So this area is also where, just kind of do some slight circles around that bregma. There can be dural tension here, and we want to loosen that up. When you free this up, it actually even stimulates your parasympathetic nervous system. And if you're in fight or flight, if you're in constant stress, there is less of a chance that that ear is going to drain, and we want it to drain. Good. Oh, I could just hang out here for a while. Good. So now we're going to go to the temporal bone. Notice we're doing both sides, even if your eustachian tube dysfunction is just one side. Go just above your ear, and we're going right there. And we're just going to move that around. I'll let you see that here. Good. There are little blood vessels that pass through these little sutures in between the bones. They supply the bone, the connective tissue of the suture. Let's keep it metabolically alive. Let's move it around. Okay, so now we're going to go over towards your eye. If you feel dizziness or anything like that, just stop this and go repeat the first part of this video again. And what we're going to go to is we're going to go right here to something called the sphenoid bone. It's right behind your ear, your eye socket. And then we're going to pull that temporal bone away from the sphenoid bone. Then we're going to pull the parietal bone a little higher away from the sphenoid bone. Just pull, 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 pull. Switch hands. We're going to pull the temporal bone away from that sphenoid bone. This is some of the wonderful cranial work that can really help your ears. And then we'll pull here, which is the frontal bone. Beautiful. Now let's go back to our temporal bone, and let's do a little ear pulling again. Pull, feeling that, using the power of the vibration. The vibration. Okay, now pull a little bit more. And pull the lower part. This is so good. And a little bit close to the ear. And now go right in front of the ear, and just pull, pull, pull. Let's go to the other side. All right, so we're going right to the temporal bone. And let's go back here all along that joint. Okay, and now we're going to go right to the sphenoid bone and pull that temporal bone around, out of the way. Pull the parietal bone. You got it. Learning your cranial work a little here. Okay, let's go to the frontal. Right here, taking all your hand, your whole hand, just pulling the front of your skull. Sometimes you have hit your head, and that frontal bone just gets locked in there. Now let's go even the zygomatic right here. Beautiful. Doing good. So now let's do actually the neck. Let's get all these lymphatics going. So I'm going to first go to the what's called the gall breath technique. So take your fingers like this to your jaw and right under the zygomatic arch here, and we're going to pull down and away. Like you're pulling this way. So you're pulling your jaw kind of out of the socket. Let your mouth relax. And we're just going to vibrate that. And relax and pull it again. You'll feel this in your ear if you can really relax into it. I'm talking, so not as much. There you go. The jaw and the ear are roommates. I mean, they really interact a lot. I find a lot of people come in my office with tinnitus. Sometimes it's the jaw, sometimes it's the muscle, sometimes it's the cochlea. Okay, now we'll get the neck. And so now that we've done all this up here, we're going to just bring that lymphatic fluid down. So it's down and a little bit towards your clavicle right here. Beautiful. I think I got a little mucus came down. Oh yeah, we love that mucus. Okay, let's go ahead and do the other side. So again, we're going to pull here like this, and then vibrate right on your hand. And just pull and release. Pull and release. Here we go. Make sure you get low inflammation diet, of course, spore-based probiotics. I love microbiome labs. Allergies, don't ingest allergens, stay away from them. Sometimes you get biofilms on the nasopharynx that are just really clogging up that eustachian tube. And I get my finger back there. I do something called the Muncie technique. Okay, let's go ahead and just pull that lymphatic fluid down right from this, just the side of your neck, going all the way down towards your clavicle. Beautiful. Isn't it great to have this tech? I like this rapid release one. Get one that works for you. So good. Okay, so we're going to do a couple of 45-degree stretches. So I'm going to go here like this, and then vibrate right there. Again, any dizziness, stop immediately. Tuck the chin. We're trying to open up that suboccipital. Suboccipital is such a good area. So many people I do muscle work there. You can do muscle work, and all of a sudden they go, oh, I'm draining. Oh, it's going down the back of my throat. You've got these little muscles here that can be involved with the eustachian tube, can help with the parasympathetics. Who knew your neck and your ears were so dependent on one another? It's all connected. Okay, let's go to the other side. If you want, you can just vibrate down here at the trap, or you can even lift it up and bring it down like that. Good. I mean, ear pressure can just be, your neck being a little bit dramatic. Check out my neck videos, the other eustachian tube dysfunction videos. Okay, the next one's a little bizarre. We're going to go in the mouth a bit. So you're going to get both your thumbs. We're going to go to the, there's a suture there in the middle of your mouth, and you've got the maxilla bone here. We're going to get your thumbs in like this, and we're going to pull apart. Hold for 6 seconds and release. So, don't get your teeth, just more your palate. Hold. And release. Hold. The sphenoid, the palatine bone, the maxilla, if they get all locked up, it can actually change things right back there in your nasopharynx where your ears drain out. So we want to make sure that's all open. You'll feel this right away. You'll feel like, oh, I'm a little bit more open here. Keep up the good work. Here's to less pop and more peace.